Welcome, everyone. As some of you might know, I'm Susan O'Brien. Let me just, these faces here are kind of distracting me. I am the secretary of OSARC. And typically our meetings are run by Joan, uh, uh,
Rovi.
On Borovoy, sorry. I was getting distracted. At any rate, the meetings are typically run by John Borovoy, but she is luckily for her, she's on a much needed, lovely vacation to Ireland. So we hope she's having a wonderful time. So I'm going to fill in for her today. So have mercy because it's not something I do, and she does it very well. So if I need help, I'll yell. So I just first wanted to start by mentioning who is on the board. As I mentioned, Joan Borovoy is the chair. Mark Lewis is the acting vice chair. Colleen Cox is a volunteer. And we have Megan Wolfsey Flanagan and Rob Spencer from OSA helping us out today, which we really appreciate. I also wanted to mention that we had another volunteer for the last few years. Her name was Judith Lovell. Many of you may remember who she is. She has decided to leave the board because I think we announced this a couple of months ago, she became a minister and decided on moving into a second career and is very active in community activities and such. So she doesn't have time for us anymore. Um, but I, for one, really appreciate all of her involvement in the board, which wasn't a ton, but she was able to do an enormous amount of help for us. So, first of all, it was her son Kwame who gave us that great presentation, I think last year, year before, on cell phone usage, and people really enjoyed that and learned a lot from it. And then she also had, oh yes, the lawyer Miss McAdoo, who talked to us about estate planning. Many people told us later that that was extremely helpful to them. And then she also used an acupuncturist who she asked if she would come and speak to us. That was that woman Heather. That was also a very interesting program. So, you know,
Sorry, Susan, I muted by accident. Susan, unmute yourself
how long have I been muted?
for 1 second.
Oh,
I was
okay.
trying to mute someone else and I hit your thing by accident.
Okay.
Sorry.
See, we don't know what. Anyway, so this is just, and actually, I wish her the best, and hopefully she has a wonderful new career ahead of her. But it also, I'm reminded to ask folks to think about things you might like to hear about, because the way we find people to come and speak to you is that we think of things, or we just walk in the neighborhood and something strikes our fancy, or we attend a presentation. And this summer, we'll be sending out um, requests for you to tell us the kinds of things you're interested in. So we'd really appreciate that if you respond to that because it helps us to know what you like. Um, but it also would be great for you guys to pass along a name. You don't have to do the work. We'll do the work. Just give us somebody who you might think group would like. Okay, so enough said there. So moving on to the presentation. Um, we have been wanting for a while to have people come and talk to us about the September 11th Victims Compensation Fund and the World Trade Center Health Fund, and so World Trade Center Health Organization. And Rob Spencer has been very active with these groups for many years, and so he is going to introduce and manage this next part of the presentation because he's so intimately familiar with them. So, Rob?
So thanks, Susan. As many of you know, I've been involved in the struggle for 9/11 healthcare for about 25 years. And on behalf of the union. And I'm going to introduce today's guest speakers in a minute, and each will present for about 15 minutes, followed by a question and answer session. We'd appreciate it if you'd make a note of your questions and hold them until after both presentations. As always, it's usually best to use the digital raise hand function, which you'll know you find either below your screen. It's either a separate raise hand function icon or it's in reactions. So I hope you can use that as a preferred way. But if you do put it into the chat, we'll do our best to try to recognize you and answer it that way. Before we start, in order to give our guests and the union a little bit better sense of your involvement with 9/11 health issues, we wanted to do an anonymous poll with 5 questions. I'm going to launch the poll and pray that the gods of Zoom work on our favor and that it all works out smoothly. Basically, we'd appreciate your choosing a yes or no answer to each of these 5 questions. I'll read them out loud, give you some time to answer them, and then once it's done, we'll stop the poll and we'll read out the results, which is a percentage of how many answered yes or no. So I'm going to try and do that now, and we have to have a little prayer here that it works well. So do folks see this? Someone tell me if
Yes,
you see.
Rob.
Okay.
Yeah.
So the first question, which I'm going to read, is: do you know the difference between the World Trade Center Health Registry and the World Trade Center Health Program? So that's a yes or no question. The second question is: are you enrolled in the World Trade Center Health Program? The third question is: do you have health conditions you know or believe were caused by exposure to toxic dust and smoke on 9/11 or in the months thereafter? The fourth question is: are you registered with the September 11th Victim Compensation Fund? That's different than filing a claim. The fifth question is: have you filed a claim with the September 11th Victim Compensation Fund? So now that I've read all of those, I'm going to give you probably about a minute to make sure you can answer all of them. And then I'll stop the poll and we'll read the answers. Also, they will share with you, I think. And just a reminder, this is anonymous. We don't tie answers to any person. Um, so we won't know how you answered unless you do what Ethel did, which was which was put our answers in the chat, which we'll have to add on, I guess, at the end. Trying to give people a little bit more chance because we only got like 63% participation at the moment. Give it another like 15
I can
seconds.
only see, Rob, I can only see questions 1 and 2.
Scroll down.
Scroll down.
There's a scroll bar on the right side. Boy, people are still answering. I'm loath to stop it because it keeps we keep adding a few people. Okay, I think I'm going to end up stopping it at this point because otherwise we could sit here for quite a while. So I'm going to end that. And basically, the first question, 69% said they did not know the difference between the health program and the health registry. 31% said they did. On the second question, 78% said that they were enrolled in the health program, although, and 22% said, said they were not enrolled, and 22% said they were. So it's a very small percentage that were enrolled. On whether you have a health condition that you think or know to be connected, 41% said yes, 59% said no. On are you registered with the Victims Compensation Fund, 28% said yes, 72% said no. And finally, have you filed a claim? It's only 9% that have said yes, and 91% said no. So I just shared that with everybody so they can see that. And then I'm going to, in about 10 seconds, I'm going to stop that. And then I'm going to go to the introductions. Okay. So, um, the World Trade Center Health Program is a federally funded program that was established under the James Zadroga 9/11 Health and Compensation Act in 2011 to provide eligible responders and survivors with health care for 9/11 related physical and mental health conditions at no out-of-pocket cost. Kimberly Flynn, who will be the first speaker, co-founded and is director of 9/11 Environmental Action, which is an activist organization of residents, school parents, and environmental and worker health and safety experts. I've worked closely with Kimberly for more than 2 decades on 9/11 health issues. Her organization formed to demand the health of the downtown community be protected from the environmental hazards released in the destruction of the World Trade Center. Since 2013, her organization has served as a World Trade Center Health Program outreach partner, conducting outreach and education like this program to residents, students, and area workers exposed to the World Trade Center disaster in Lower Manhattan and Western Brooklyn. The September 11th Victim Compensation Fund is a federally funded Department of Justice program that was established to compensate for physical harm or death caused by the terrorist attacks or debris removal efforts in the aftermath of the 9/11 attacks. The VCF is open to first responders, but also to those affected who lived, worked, or went to school downtown. The VCF presenters today are Nicole Smith and Stathi Patseas. Ms. Smith has dedicated over a decade of her professional career to the VCF since the fund reopened in 2011 as a result of the passage of the Zadroga Act. She has served in various leadership roles in the program. In 2022, she received the U.S. Department of Justice Civil Division Special Commendation Award in recognition of her exemplary service. And in 2023, she was appointed as the Deputy Special Master of the VCF. Mr. Patseas is the VCF's Manager of Communications and External Affairs. He joined the VCF in December of 2023 to focus on expanding the program's outreach efforts. He works to build broader awareness and understanding of the VCF, coordinates with 9/11 advocacy groups, works to establish relationships focused on easing the burden on claimants, and develops new outreach materials and public messaging. So we're going to start with Kimberly Flynn from 9/11 Environmental Action, and I'll turn it over to her.
Thank you. Thank you, OSA retirees, Susan O'Brien and Rob, for inviting me. And I want to thank Megan Flanagan in advance for being kind enough to share my slides. As you all can tell, we've been working with survivors for a very long time. Our motto is, if you were there, we can help. So I'm going to start with encouraging those of you who may have questions or need help either applying to the program or need help with navigating the program to please get in touch with us. There's going to be a contact slide close to the end. Okay, so Megan, can we go to slide number 2, please? So what is the World Trade Center Health Program? I'm going to start by saying what it is not. It is not the World Trade Center Health Registry, and it is a separate program from the Victim Compensation Fund, though it is linked, as you will hear later. The World Trade Center Health Program is a limited federal health program that provides no-cost medical monitoring and treatment for eligible responders and survivors with certain health conditions that have been certified as related to their 9/11 exposures. In other words, 9/11 related conditions. I want to emphasize that the program is not an insurance. Survivors receive care at no out-of-pocket cost, and survivors' primary insurances are charged for the services of the program. The program pays any co-pays, balances, or deductibles. Okay. Next slide, please, Megan. So who are survivors? Well, we're not responders, but we are residents, students, area workers who were present in the New York City disaster area on 9/11 or in the weeks and months following. And we are people who were directly impacted. Next slide. So survivor eligibility is informed by your answers to two questions. Were you there? And are you sick? Meaning, do you have mental or physical health symptoms or conditions that you believe are linked to your 9/11 related exposures? Next slide. So where is there? There is the New York City disaster area, approximately 1.5 mile radius from the World Trade Center site. It's the area south of Houston Street and Manhattan, and it's a wedge into Western Brooklyn that encompasses Dumbo, Brooklyn Heights, and downtown Brooklyn. And when did you need to be there? So 9/11 day of is enough to qualify you for the health program. And then you need, if you weren't there 9/11 day of, you need sufficient time, sufficient presence in the New York City disaster area between 9/12/01 and July 31, 2002. And you have to have been there for a reason, lived there, worked there, attended school or daycare there. If after 9/11 you went shopping there, or you went downtown to see what happened at the site, that doesn't count. Next slide, please. So, and what are the symptoms that may be linked to your 9/11 related exposures? Do you have any of these symptoms or illnesses that started on 9/11 or that got worse? And that's really important because people say to us, well, I had asthma before 9/11. Well, did your asthma get worse after 9/11? And very often the answer is yes. So these are the most common symptoms and conditions related to World Trade Center exposures. They fall into three categories. Aerodigestive. So that's the aero part is upper respiratory, like sinusitis, lower respiratory, like cough, wheeze, asthma, and digestive, as in GERD, gastroesophageal reflux disorder. Then the second category is mental health conditions like PTSD, anxiety, and depression. And the third category is cancer. All cancers are covered except for the cervical cancer caused by HPV, which is a virus. Next slide, please. So here's the equation. If you were there in the New York City disaster area, sufficient time between 9/12 and 2001 and July 31, 2002, or you were there on 9/11, plus you are experiencing at least one of the mental or physical health symptoms or illnesses, then you should apply to the World Trade Center Health Program. And we have to say you may be eligible for care, but it's very, very likely that you are. Next slide. And there is, of course, a full list of conditions covered by the World Trade Center Health Program on the website at this link. Okay, certification. So once your application is accepted, in order to receive treatment and monitoring from the World Trade Center Health Program for your 9/11 related health conditions, those conditions must be certified by the program. To be certified for your health condition, that condition needs to be on the list of WTC conditions and needs to be evaluated by a World Trade Center Health Program doctor or provider who recommends that you be certified for that condition, recommends to the federal government that you be certified. And then the actual certification is the official decision by the program that your condition resulted from 9/11 related exposures. And a really quick note on acute traumatic injuries. So the program defines these as injuries from the day of 9/11, like falling while running, for example, or being hit by falling debris. We have pressed the program to consider, for example, knee injuries incurred by residents who had to go up and down stairs in high-rise buildings without electricity. And the program said that it would use its discretion. Next slide, please. So where do you get survivor care in the World Trade Center Health Program? Care for survivor members who reside in New York City is provided at several clinical centers of excellence in New York City. First, the World Trade Center Environmental Health Center, which is also known as the New York City Health and Hospital Survivor Program. The clinics are at 145 East 32nd Street in Manhattan. So this is the Bellevue Clinic, which needed to relocate in order to expand. Second, Gouverneur Health Services in Lower Manhattan, and third, Elmhurst Hospital Center in Queens. Then there is the William Street Clinic, which is operated by LHI Logistics Health Incorporated. That clinic is at 156 William Street in Lower Manhattan. Care for survivor members of the World Trade Center Health Program who reside outside the New York City metro is provided by the Nationwide Provider Network, which is an extensive network of providers across the country made available through a central administrator. In this case, currently, and for the last few years, MCA Sedgwick. If folks are having trouble getting care from MCA Sedgwick, get in touch with us, we can help. Next slide, please. Okay, so, you need to complete the World Trade Center Health Program application form. It's the form for survivors. You can apply online or you can submit a paper application by mail or fax. We strongly suggest that whichever way you choose, that you download, that you fill in and download and print out the form on paper, okay? So that you can use it as a worksheet, you have notes, and then you will finalize that in a clean copy. Always keep copies for yourself. If you're applying online, you have to print it out. It's really important because the clinic where you're going to have your first evaluation, they do not have any of this information. And when you're answering questions, people often forget or sometimes become flustered. You really, really want to have that piece of paper to refer to. Also, an application is not complete unless you have supporting documentation. So you're going to need written documents showing where, in your case, where you worked in the New York City disaster area between 9/11/2001 and 7/31/2002, or that you were present in the dust or dust cloud on 9/11. Now, this is not a great slide for you guys, but we couldn't fix it and then wait for approval. So here is what workers will need. Workers need a letter of employment or pay stubs showing that they were present in the New York City disaster area and for what time period. Lacking those items, you will need to get a third-party attestation. So we have seen letters for survivors from city agencies stating that the agency employed the worker and for how long. But these letters at times do not include the location of the office or the work. Third-party statements from a supervisor or coworker or pay stubs will work, of course. And I'm just going to shout out to the VCF, to the Victim Compensation Fund, because they have created a witness presence form that will work 100% if you are trying to document your presence, your work in Lower Manhattan below Canal Street, below Houston Street, so between Houston and Canal. You can use the VCF's witness presence form as a guide So it basically shows you the information that your third-party witness would need to provide in their statement. Now, we put an asterisk on this slide to say the following. If you are not sick from 9/11, we strongly, strongly recommend that you gather documentation of your presence now so that you will have it ready should you become sick in the future. This is really important. We've had many area workers come to us who are having just a terrible time. I mean, we've had people whose businesses moved to Australia. I mean, it's a long list. It's very unfortunate, and it can become really hard, folks. So if you were there, get some presence documentation, while it's readily available. Okay, Megan, next slide, please. Okay, so this is about a really important initiative, the youth research cohort that originated with the survivor community and the Survivor Steering Committee, on which Rob and I serve. Many people do not realize that there was no scientifically valid means to track the emergence of new illnesses in the population of people exposed to 9/11 at a young age. The effort was not authorized by the Congress after a very significant push until December of 2022. So you see the map that shows the eligibility, the geographic eligibility for the cohort. To join, you need to have been 21 years old or younger, and that includes being exposed in utero. And you need to have lived, worked, attended school or daycare in the area colored in purple. And here is my plea. If this is true for any of your children, please get in touch with me because it's likely that they are eligible for the youth research cohort. Next slide, please. Okay, so this is that contact page I was speaking about. A really good way to contact us is this email address, info@911ea.org. We respond in less than 24 hours. So I highly recommend that if you have any questions or any issues, please get in touch with us that way. We also have a voicemail, but the email is faster. Okay, so next slide. Thank you. So here's the contact information for the World Trade Center Health Program itself. And the number 888, we call it the 888 number. It's a way to speak with the federal call center. Federal call center is very helpful. So, we think that's also a good place to go with questions. And now I'm going to shift to give you all a quick update on, and I'm sorry for the dinging of my email. Please forgive me. I want to give you a quick update on the World Trade Center Health Program. As some of you may know, the program has been subject to reductions in force. There have been at least 2 waves of RIFs. The good news is that as of yesterday, Dr. Howard, who has long served as the administrator, Dr. John Howard, long served as the administrator for the World Trade Center Health Program, has been fully restored to his position. Also restored are 25 CDC employees who had critical roles in the program's operations, and 10% of the staff of NIOSH, National Institute of Occupational Safety and Health, who also have critical roles, have been restored. So we know that there have been delays. We know that there were delays in enrollment processing, for instance. We know that there were delays. We know this also has been in the press, delays in certifying conditions, including conditions that were emergency conditions needing emergency care. We know that the Chief Medical Officer for the FDNY 9/11 program, attempted to get pancreatic cancer for one of his members certified and was unable to do so several weeks ago. We have been told that these terrible obstacles now have been eliminated. So that's the good news. And final slide, I think it's the final slide, please. Yeah, so thank you. In particular, I want to thank Rob Spencer for countless hours of work over the years on behalf of all survivors, and especially for always pressing for the needs of working people exposed to 9/11. Thank you. Okay.
Megan, you can stop sharing.
Yeah, thanks, Megan.
Rob,
Okay.
I put that information in the chat, the contact information from her
Right.
page.
So I guess that we'll move on to the Victim Compensation Fund. I'm not sure who's going to be presenting first.
Hello, it's Nicole from the VCF. As Rob mentioned earlier, I am one of the Deputy Special Masters here at the September 11th Victim Compensation Fund. That is a mouthful, so we commonly refer to ourselves as the VCF. And so I want to welcome everybody that wasn't here at the outset, say good morning or good afternoon to you all, and just let you know that it's such a privilege to be here with all of you. I also have with me Safi. He's our Manager of Communications and External Affairs. And we want to thank Rob Spencer and Susan O'Brien from OSA for facilitating today, and also to Kimberly Flynn for joining us and sharing this very critical information. We're just going to give a very high-level quick overview of the VCF, how you can register, how you can file a claim, and also how you can be ambassadors in your communities to spread the word about the VCF. And so with that, I'm going to pass it over to Safi.
Great. Thank you so much, Nicole. And echoing gratitude to be here and appreciate Rob, Susan, and Kimberly for helping us spread this information. As Nicole mentioned, we have a very high-level explainer of the program. I think there is definitely some fundamental information about the program that Kimberly has covered, but there are some key differences between the programs, and we'll touch on some of those. We'll talk about a little bit about the history of the VCF, and then everything you need to know to register and file your claim with us, and finally, how you can spread the word. And we're happy to stay on as long as necessary for questions. Great. So the VCF is a compensation program. We provide compensation for individuals with 9/11 related illnesses, physical illnesses or injuries, or relatives of deceased individuals who have succumbed to their 9/11 related illness. And we cover the following time periods and sites that are on the screen here. The World Trade Center and surrounding VCF, what we refer to as our exposure zone. You'll see a map in a following slide, and our dates are a little different from the health program. So you'll see 9/11 of 2001 until May 30th of 2002.
Can you speak up, please?
Sorry. Yeah, is it a little better if I get closer?
Yeah.
Okay, great. So it's between 9/11, 2001 and May 30th of 2002. And then we also cover the Pentagon site and the Shanksville, Pennsylvania Flight 93 site. And just an important note, you do not need an attorney to file a claim with the VCF. So this high-level timeline on the screen shows the key dates in the VCF's history. The original VCF, what we refer to as VCF-1, was established by Congress after the events of 9/11. It opened in late 2001 and closed in 2004. The Zadroga Act was signed into law in January of 2011, and it reopened the VCF, which is what we now refer to as VCF-2. It expanded eligibility criteria and established a claim filing deadline of October 3rd, 2016. The Zadroga Act was then reauthorized again in 2015, which extended the claim filing deadline and provided some additional funding. And the very important milestone in 2019, the Never Forget the Heroes, James Zadroga, Ray Pfeiffer, and Luis Alvarez permanent authorization of the VCF was signed, establishing the VCF as a permanent program, fully funding the program to pay all eligible claims through October 1st of 2090. So with that being said, we're essentially a permanent program with unlimited funding, which is not a responsibility that we take lightly. So we help, as many of you know, uniformed first responders. With that said, the VCF is not just for uniformed first responders. It is open to workers like yourselves, volunteers, folks who participated in the rescue, recovery, and cleanup operations. We also have those who worked for government agencies or victim service providers at all three sites. That includes media personnel, journalists, photographers, really anyone whose work required them to be at a 9/11 site. It also includes those who in New York City who lived, worked, visited the area, attended daycare or school at the time, and have been exposed to those toxins. This includes everybody who returned to their offices, back to their homes, maybe never left their homes, and were being exposed between those dates. 46% of our claimants right now are from that population that we refer to as survivors. And that does not mean that they survived the actual day of 9/11, but it's a term that we use to designate anyone who was not part of the response, recovery, and cleanup operations. So to give you a sense of where we stand with claim filings, we have our monthly statistics as of April 30th. You'll see there we have received about 99,000 claims, and we've found over 66,000 claimants eligible for compensation, with a total award amount of $15.5 billion since 2011 when the VCF was reopened. Our claims come from every state as well as different countries. This is not just a New York City problem, but really a global issue. And this, these monthly statistics that we publish them on our website and our social media give sort of a sense of the scope of the program. And with that being said, I'm going to pass it back over to Nicole to discuss our 3 basic steps.
Thanks, Stapi. So we have 3 basic steps for registering and filing a claim with the VCF. The first step is to go online, vcf.gov, and create an online account and register. The second step is to get certified by the World Trade Center Health Program for a physical health condition. And finally, step 3 is to file your claim by October 1st of 2090. That is the same filing deadline for everyone. It's important to note the difference between registering and filing a claim. Registration is not the same as filing a claim. You do not need to be sick to register. And if you answer yes to the question, were you there? We encourage you to register now, even if you are not sick. Registration is simple and preserves the claimant's right to file a claim in the future. And once a potential claimant is certified by the World Trade Center Health Program for a physical health condition, they would then submit their VCF claim form and the required supporting documents. We want to note that an attorney is not needed to file a claim. And if you run into any issues at all, please call our toll-free helpline for support. So Stapi mentioned the New York City exposure zone earlier, and Kimberly mentioned the New York City disaster area for the health program. So to be eligible for compensation, we need some type of proof that a claimant was present in the shaded geographical area in Manhattan, which is what we refer to as the New York City exposure zone. It is Canal South, river to river in Manhattan. We also cover routes of debris removal and also the Fresh Kills landfill. If you worked, were employed, volunteered, or were for whatever reason in this exposure zone between September 11, 2001 and May 30th, 2002, you could possibly be eligible for compensation with the VCF. We work with different employers, unions, and other organizations to share information and also identify available documents to support presence for their members, employees, or volunteers. And because we know that proof of presence is a challenge, we recently launched a new tool on our website, which is interactive and scenario driven. So in just a few minutes, a claimant could identify the specific documents that they need to prove presence based on their individual circumstances. The interactive presence guide is accessed on our website's How to Prove Presence page, and the guide prompts the user to answer several simple questions about their unique situation, and at the end, they can print the details of what they need to submit with their claim to prove presence. The guide does not store any information, and it can be used as many times as needed. And since we launched it, we've had almost 7,000 users visit the How to Prove Presence page, and almost 4,000 have visited the interactive presence guide. And so before I talk about how we calculate VCF awards, I want to quickly go over a few of the differences between the VCF and the World Trade Center Health Program. This is a handy reference chart that explains the differences, and we are going to provide our slides after the presentation, but I just want to highlight a couple things. So registration for the VCF is different from enrollment with the World Trade Center Health Program. We are separate, and it's possible for an individual to be certified for treatment by the health program, but not eligible for compensation from the VCF. And that's because we have our own criteria. We have different criteria that each individual has to meet. And by law, the VCF can only cover physical conditions, whereas the health program can certify and treat both physical and mental health conditions. Another difference is where someone was. So for presence at the VCF, if you're in the New York City exposure zone, at the Pentagon or the Shanksville site, that's enough for us. For exposure, the health program requires that someone has been at one of the sites or in the New York City disaster area, and they're trying to tie their condition to how long they were exposed and where they were exposed. The next difference is the time frame. So for VCF, our end date in New York City is May 30th, 2002. And as Kimberly said earlier, in New York City, the health program goes all the way to July 31st of 2002. Our dates and timeframes are the same for both the Pentagon and Shanksville sites. And then also, how long was someone there? For presence, the VCF has no minimum time frame, but for exposure, as Kimberly mentioned earlier, they have different minimum time requirements to tie that person's exposure to their illness. And lastly, the health program makes a distinction between responders and survivors, whereas the VCF, we don't make a distinction as far as our eligibility criteria, our claims process, or the way that we calculate awards. And so with that, I'm going to run you through really quickly how we calculate awards, because we are a compensation program. And so our overall formula looks like this. It's non-economic loss, which is typically pain and suffering, plus any economic loss, which includes lost earnings, medical expenses, burial expenses for a deceased individual, and replacement services. And then by law, we have to subtract any collateral offsets. So that means if you're receiving disability benefits from Social Security or workers' comp, we have to by law subtract those. And that equals the total award. There is no cap to the total award that an individual may receive, but there are certain limitations to the input for the awards, and that's based on the law that governs the VCF. Our awards are not subject to federal income tax, and they cannot be garnished by Treasury. And so with that, I'm going to turn it back over to Stafi, who's going to talk a little bit more about our outreach.
Great. Thank you so much, Nicole. So as many of you know, as many as 400,000 individuals are estimated to have been exposed to the toxins in the New York City exposure zone. And as you saw in the previous slide where we mentioned some of our statistics, we've received over or just about 99,000 claims. So clearly there's a gap in the universe of potential claimants for us to reach. So outreach is really a big priority for us, and doing presentations such as this one is something that we do consistently for groups to help spread this important information. On our website, vcf.gov, we have an outreach toolkit that has social media graphics. It has language for email blasts and newsletters, printed materials that people can print and take to events as flyers, just like the one you'll see on the screen there, which is one of our rack cards. We host, as I mentioned, these webinars. We're always looking for partnership opportunities. We attend a ton of community events in New York City. And we are really hoping to build an informal network of ambassadors who can help spread this critical information. So I encourage you all to think about, obviously yourselves. I know some folks answered through the poll that they definitely are registered for the program, and also folks who haven't registered yet are eligible for the program. But even if you're not, think about who you know, friends, family members, former coworkers, anybody who might have been impacted by 9/11 and could be eligible for these programs, and just spread the word. Tell them to go to vcf.gov, tell them to call our helpline. We have a lot of resources to be able to help potential claimants. And as I mentioned, these are sort of the things that you can do to help. If you yourself are eligible, please register for the program now at vcf.gov or call our helpline. We also have access to interpreters for anybody who's limited English proficient. Our website is translated into multiple languages. Again, we encourage you to become a VCF ambassador and to help spread this word and utilize any of those outreach materials on our website. I will keep this slide up here just as we open it up for questions for both Kimberly and for ourselves. But once again, just want to thank Rob, Spencer, and Susan for having us today. Nicole and I both love doing these presentations and helping to spread the word about the program. And once again, if you have any questions after this call, feel free to call our helpline. Really fantastic resource in a group of individuals who really care so much about helping claimants. If you're on X, or formerly Twitter, please give us a follow at the handle on the screen, and feel free to scan the QR code if that's easier for you to access our website. So with that being said, I'll happily open it up for questions or defer to Rob.
Yeah, I can manage that for everybody. So thank you so much, Stathi, Nicole, and Kimberly. And Rob, did you want to say anything before we open it up for questions?
No, I'd just like to thank all three of the presenters for, giving us an overview. And I'm hoping that if folks have, questions, they'll pose them. I know there was one in the chat that's an actual interesting one that a lot of people have faced. So we should actually, hopefully Kimberly may be able to address that one.
Well, why don't we say this? Why don't we have people to begin using the raised hand function to get in the queue so we could figure out who would like to ask questions? Do you want to start with the one in the chat, Rob, since that person, or do you want to wait?
Why don't you give a couple of people on the raised hand, and then we'll bring that one, because that's a longer one. I have no idea what these other folks are going to ask.
Okay, so the first question is from Sheila Hudson. Sheila, can you unmute yourself, please?
Hello.
Hi.
Okay. I worked at 80 Center Street, probably sometime in April or May of 2002. But I'm having difficulties establishing the proof of presence because I was employed by a temp agency, which is no longer in business. Yeah. They just like poof, disappeared. The job where I worked at 80 Center Street, ironically, was for a group called Trial Lawyers Care, which was a group of lawyers who were providing pro bono services to 9/11 victims. They no longer exist. So, and last year in October, I was diagnosed with breast cancer. So I've tried everything. I've got proof from Social Security that I did get paid by this temp agency in 2002, but it doesn't have any dates. I've tried the Department of Labor because I also filed for unemployment, probably based on this employment, and I didn't get anything helpful from them. I've done emails, I've done social media posts. I'm registered with VCF. I'm in the process of trying to register with the WTC Health Program. So what they wanted was just a statement from somebody saying that they knew I worked there. So I had my sister write a letter because I used to come home and talk about, the stuff I was doing at work. So I just submitted that. I haven't heard back. But my question is, does anyone have any suggestions about how to prove my presence there for employment? But also, just at the last slide, I think, or the comparison slide that Nicole showed, it seems like if I can get past the WTC health certification, I also have proof that I was in court. I had a couple of court dates in housing court in that time period. So I'm wondering if that would suffice for the VCF claim, since they don't have a minimum time period.
Thank you, Sheila. Okay, how do we want to start here? Anybody want to start first?
I know it's a lot.
It's fine. Kimberly, you want to start first, or do you want to pass it over to Nicole and Stati?
So I just briefly, Sheila, it sounds like you are doing exactly the right things. And you are aware, I'm sure, that in the World Trade Center Health Program application form, it asks you whether you attempted to get proof of presence, although they probably ask it a different way, but tell us what efforts you made to attempt to demonstrate presence. And if you did that, great. If you need help doing that, great. You also got a letter from your sister, and that should help. And I'm assuming you also submitted for the health program application a brief statement of your own. Yes.
I did.
Okay.
And in that statement, I documented the things I just said here about all the efforts I've made. I also sent the Social Security earnings statement. I sent an email. I finally did get in touch with someone from Trial Lawyers Care, which still exists, but I don't know. I think now it's like a nonprofit or something. I got an email from them saying, oh, well, the organization you work for didn't exist after 2004. I sent that email as part of my application.
So it does, I mean, it sounds like you did everything right. If you do not hear back from the program, we're telling people now, give it at least 6 weeks. But please get in touch with me.
Okay, I will.
Okay.
Okay. All right. Thank you for that.
And I'm so sorry about your breast cancer.
Yeah. It was just so timely when I got the notice about this meeting. I'm like, ooh, this is
good. I'm glad we were able to be helpful. Okay, so Nicole or Stati, do you have anything to add?
So yes, Ms. Sheila, I echo the same sentiments. I'm sorry for your diagnosis, and I hope you're taking good care of yourself. As far as proof of presence for the VCF, I encourage you to use our interactive presence guide. We make a point of not discussing specific claims during these presentations because you may have documents that, when a reviewer is actually looking at your whole claim could be sufficient. And I don't want to tell you, that it definitely would be or it wouldn't be because I don't know all of the facts surrounding your claim. So any documents you have, you mentioned that you were at Center Street and that you were at court, get those documents if you have proof of that. You say your sister gave you a statement for the health program, submit that. If you have any coworkers, friends, neighbors that saw you in our New York City exposure zone, they can complete what is called the witness presence statement that Kimberly mentioned earlier. We typically need someone that was an eyewitness if you can't confirm, via your employer that you were in our area. So I'd say submit everything that you have. And then one of the things that I didn't mention during our brief presentation is that if you are denied eligibility with the VCF, we have an appeals process. And so if you can't get documentation that would make you eligible at the outset, you can appeal and you can come in and testify and share your story under oath. And we can ask questions and fill out the story that way.
Okay. All right. Thank you.
And Susan,
You're welcome.
can I just
Go ahead.
Sheila's story is an illustration for why it is that people who were there and who may not have symptoms yet need to gather their presence documentation now when it's still possible to find people to, I mean, there are a host of ways of doing this, but time is not on your side. And a lot of survivors have learned that the hard way.
Right. Thank you very much. Now, I just to interject, I signed a witness statement for a friend who was applying because I had lunch with her a couple, I don't know, 2 or 3 times a month, and we were in the exposure zone. So that was an important piece that helped her with her claim. So thank you all. Okay, so Sheila, unless you have anything else, you wish
No,
to guest
no,
forward, and
no. I
please use
appreciate
them.
the information, though.
Okay, wonderful. Thanks so much.
And can I just add really quickly, Susan?
Sure.
So, Ms. Sheila, if you happen to be denied, do not consider that a door closing. It's not the end of the road. Appeal if you are denied, and we can, go from there. Okay, that's for everyone.
Thank you.
Okay. All right.
Thank you.
Okay, the next person is Howard Babbage. Howard, you want to unmute yourself, please?
Yes, thank you. And thank OSARC so much for this. One question I had, I think it's similar to Sheila's and may have been answered. I worked before, after, during, and after 9/11 at the health department, ironically, down on Worth Street, and tried to get proof from them. And they checked their records and said they had no proof that I worked there. So, I mean, and I have 2 letters from colleagues saying that I work there. So I don't know what I have to do to get the health department to give me some sort of proof that I work there. And also, real quick, on the second question, my understanding that the law requires that all employers notify employees that these benefits are available. I don't know about anybody here, but I have heard absolutely nothing from the city of New York. And I don't know if they think they're above the law, but is the city required to notify us about these benefits?
No, that's a problem. And believe me, Rob and I raised that problem in a meeting with State Senator Kavanaugh, for instance, who was a chief sponsor of the bill in the state Senate. It's basically, it encourages. It says they should. It does not say they must. So now, as far as the health department is concerned, I'm assuming that you are not in the World Trade Center Health Registry.
Right.
Okay, because that's another way, folks, that you can establish presence. Is if you are in the registry, then what you want to do is contact the registry and ask them to send you the answers to your Wave 1 survey so that you can use that for presence documentation. And, I can write that up in the chat. But Howard, I will see, excuse me, I will see if I can find a contact at the DOH. It's not going to be easy to get that kind of proof from the DOH, but from what you were telling me, it sounds like you don't need that what you've gathered, in addition to, information that you would provide on the World Trade Center Health Program application, saying that you made the effort, that the DOH gave you nothing, but that here are these 2 letters. That should be sufficient.
Oh.
Depending, now, again, I haven't seen the letters and, there's critical information that needs to be in the letters. But if the letters address, where you worked and when you worked below Houston Street, then that should be sufficient. If you want to get in touch with me and we can talk about this further, that'd be fine. But I think for the program, if you have the right information in those letters, then that's going to be enough.
Okay, wonderful. Thank you so much.
Thank you.
Susan, before you go to another question, I just wanted to ask Kimberly if she would mind just explaining the difference, because we had that in our initial poll. Could you explain the difference between the
Yeah.
World Trade Center Health Registry and the World Trade Center Health Program?
So the World Trade Center Health Registry was a shared project of the federal government and the New York City Department of Health. It is survey research, okay? So what happened in 2003, 2004 is that the World Trade Center Health Registry sent out its Wave 1 survey. That's the first survey that folks were asked to fill out, and they did outreach, and there were many challenges, and the outreach wasn't great. But they did end up enrolling 71,000 responders and survivors who were exposed on and after 9/11. What they then did is sent out every few years additional surveys. The survey that you need, that you can use for presence, is the Wave 1 survey. The health registry is closed and was closed basically after the Wave 1 survey. It's a closed population. The Wave 1 survey is used as a baseline for their information. And then there are these follow-on surveys, which we encourage you to continue to complete. The World Trade Center Health Registry has used survey answers to publish research studies, and those studies have been actually important for survivors. So, for instance, one World Trade Center Health Registry study shows an uptick in certain autoimmune conditions among survivors, including area workers. But the health registry is a registry. It does not provide care. It does not provide monitoring. The World Trade Center Health Program, the whole reason for its existence is to provide care for 9/11 related health problems and to provide annual monitoring exams to track, the emergence of any additional health problems. So, if you're in the registry, don't think that you're in the health program. You have to apply separately. And if you have any of the conditions, respiratory conditions, et cetera, that I listed, I strongly, strongly encourage you to apply for the health program.
Thank you, Kimberly. Just before we move on, Howard, right? That's who we're speaking. I retired from the health department, and a number of people were asking me if I knew of somebody, and I do have a name from the HR unit. I put it in the chat. I saved it because it's like trying to find, a piece of sand on the beach, finding who the person is. It's like hidden. Why? I don't know, but it's in the chat. So hopefully that helps you.
Wonderful.
Thank you, Susan.
Sure. And Nicole or Stathi, did you have anything to add?
No, I think Kimberly covered it.
Okay, very good. Thank you.
Howard, I would just encourage you to submit whatever documentation you have. Once you're ready to file your claim, just submit what you have. And if we need more, we'll let you know.
Okay.
Great, thank you. Thank you, Nicole.
Okay, next is
I
Karen.
do have a question for you. I'm sorry, Susan.
Sure.
So the contact that you shared in the chat, so the VCF, one of the things that we try to do is develop relationships with entities to make it easier for claimants to get through the process by going directly to that entity to get proof of presence on a claimant's behalf. Do you think we could, the VCF, contact Carmen Pauletta to see if he or she is interested in developing a relationship with the VCF?
I don't see why not. I mean, I retired 4.5 years ago, but her name is still there as somebody to go, and she has delivered for people, giving them letters to prove that they. So I don't see. She is in HR in the HR department at the health department. So I don't see how it would be wrong to ask.
Okay.
Okay.
Thank you. We will let her know that we got her contact information from you if she has any questions.
Sure.
Thank you.
Not everybody asks me. I just give it all out, whatever. Okay, thanks so much. Okay, next is Karen Mangello. You want to unmute yourself, Karen?
Okay. Okay. Basically, I wanted to share how I got my proof of presence. I've been enrolled in the health program since 2009. I work for the Human Resources Administration. I understood, but when I went to file a claim, they required proof of presence. I contacted HRA, who I worked for many years, and months went by. You know, the man I was speaking with said, "Oh, his supervisor's holding it up." Finally, what I did was I reached out to my city council's office, and within 2 weeks, I had it. And he actually apologized to me because he said the person he normally works with was on vacation. So it's I'm a city, we're all city workers. So unfortunately, the city is not that efficient, and sometimes you have to work around. So my city council person helped, and that's it.
That's good help. That's good information, Karen. Thank you. Any of you folks want to comment on that before we move on to the next question?
Yeah, I think it's a great idea. Absolutely.
Yeah. Excellent.
And I kind of wish I had knew about this advocacy group earlier. This is the first I'm hearing about it. So, in fact, there are so many ads on the radio now about from a lawyer. I just called the lawyer and asked a question. So I just, I didn't keep him as my attorney. I asked a question. Unfortunately we have to dig very deep to get information. Thank you.
Right. And use what we can. Okay. Thanks so much, Karen. Mark, want to unmute yourself?
Okay, two things. One is you had a 330 number. Can you repeat that? I missed it.
I think I put everything in the chat. Let me see where that would be. 330. That I don't think I have. Sorry. But we can. We're going to get a copy. Okay, maybe they can just help you.
Okay. The second thing is I worked down there part-time. I was in the Bronx, but I had meetings at on 225 Broadway. And I had cancer, but I was treated for it up here. What do I have to get the information on the cancer and submit it, or what do I do?
So, Mark, are you asking this question about the health program? I'm assuming yes, and then you may want an answer from the VCF. But basically, if you can show that you had these meetings downtown, and hopefully you can provide, some kind of backup information. I mean, I worked with somebody who actually was
I have
on,
I have a letter from one coworker.
From one coworker.
Is that
Okay.
sufficient?
Maybe. So for the health program, I think the VCF will have to answer for itself. But if you would get in touch with me, I can take a look at the letter and I can help you with the application form. Now, what you would need to do in terms of your cancer is to provide with your application form the pathology report for your cancer. But we should actually talk so that I can walk you through some of this. Okay?
Okay.
Okay, thank you. VCF, did you want to respond?
Just the same guidance we've provided. Gather all possible documentation of where you were and when you were there. And also, you said you have an eyewitness that can provide you with a statement. If you have one more person that can also provide you with an eyewitness statement, that would also be helpful. But we'll take a look at everything, and we will let you know if we need, more information once you actually file your claim.
Okay.
Thank you.
Susan, before you go on, I just want to mention there were in the comments, I mean, the chat, there was quite a few questions about proof of presence documents. One person was asking about sanitation department and so forth. Each agency, interestingly enough, the Department of Sanitation, I think, provided a letter to respond to the people on their staff who were treated as responders, but not to their civilian staff. And I think that this is an ongoing, constant problem. A lot of folks call us. We will certainly suggest they reach out to their HR people. Sometimes their HR people are helpful, sometimes they're not. The only thing that I do know is that sometimes pay stubs are sufficient, but often pay stubs do not indicate where. They indicate when, they don't indicate where. So that can be an issue. Just letting you know that.
Thank you. Thank you. Was that all of the issues in the chat, or are there others that you're aware of?
Looking. Let's see. I think people were also interested in the difference between the exposure zones for both programs, and they were interested in the dates as well. And maybe someone could repeat those just so that that's clear.
So I'll
Hudson
just
has
jump
her
in.
hand up.
Yeah.
What was that, Mark?
I said Sheila Hudson has her hand up.
Oh,
We're just finishing the question from the chat, and then I'm going to go to Sheila. Thank you, Mark.
okay. So, all right, folks. The New York City disaster area is larger than the VCF New York City exposure zone. So the New York City disaster area is Houston Street all the way down to the tip of Lower Manhattan, and also has this wedge into Western Brooklyn, Dumbo, Brooklyn Heights, downtown Brooklyn. We actually believe that the New York City disaster area should have gone all the way up to 14th Street, but we lost that battle. Okay, so now I'm going to turn it over to the VCF on the exposure zone.
So the New York City exposure zone is Canal Street in Manhattan South, river to river. We also covered the debris removal routes that were, trucks that were going to the barges that ultimately ended at the Fresh Kills landfill. And for those routes, we are covering people that drove the trucks, loaded, unloaded, not necessarily the people that lived in the areas around the debris removal routes. So that is that was a point of confusion in the past. So,
okay, thank you.
As far as dates are concerned, the dates are the same for Pentagon and Shanksville, Pennsylvania, but for New York City, the DCF, our end date is May 30th, 2002, because that was the official end of the cleanup operation. And for the health program, they go all the way to July 31st, 2002.
Okay, great. Thank you very much. Okay, Sheila, do you want to unmute yourself, please?
Yeah. Oh, hold on.
I can hear you.
Okay. Actually, I wanted to ask Kimberly if she had provided direct contact info, because you said if I didn't hear back to get in touch with you.
Yeah, so the best way to reach me is by sending an email to info@911ea.org.
Okay.
Okay. And we respond in under 24 hours, unless it's a weekend, then we need a little more time.
Okay. And then I just had like a general statement about these lawyers and all the ads. It's a crock. It really is. I called like a couple of law firms when I first started this, asking them if they would provide help with me trying to get some proof from this temp agency that no longer exists. And the stock response is, no, you have to do that yourself. So then my question is, then what do I need you for? I'm very intelligent. I can read what's provided. I can download the forms. I can fill them out. You people should get 10% for that? No, I don't think so. So I'm just like, letting everybody else know. I'm not going the law firm route. I don't see the purpose of it at all.
Okay, thank you so much for your comment. I appreciate it. Okay, I don't see anyone else with their hand raised. I don't think I see anything else in the chat. Am I missing anything, Rob? Have you seen
Not that I
anything?
see.
Okay, so if no one else has a question, no one has a question.
Can Kimberly repeat her email address?
Yes, it's info, INFO, at 911ea.org, which is ORG.
C like in Charles, A like in Apple?
No, E like an environment.
Oh,
A
EA.
like an apple. Sorry.
Thank you. Thank you.
Okay, thank you. Okay, we do have one more question. Danita Evans, do you want to unmute yourself, please?
I really appreciate this. This is so timely, amazingly timely. Because I actually just started last year to apply and to enroll because I had started before and I got rejected. No, you were not qualified. I worked right there, so it was just amazing that I just finally started again. But now I got as far as VCF. I do have one question about that. Mental health is not covered. I know 9/11 was such a not just physical, but also mental, a lot of psychological PTSD, things like that. Why is it that mental health is not covered with VCF for compensation?
Thank you.
For the VCF, by law, we can only cover physical health conditions. It's in the statute that governs us. And what we tell people is, the health program, they are wonderful. They will certify and also treat mental health conditions, but the VCF, we cannot compensate for mental health by law.
Okay, does that answer your question?
Not happy, not happy at all. I think that should be included because it was a very traumatic experience. And just to, a little bit, my personal experience is that I didn't even realize I was affected by 9/11 until I started going through all the interviews. And that was when I realized, wait a second, what is that? There was a lot of trauma that took place and I actually hit it. Didn't know. I understand that people hide things when it's too much to handle. And I retired early, mind you. But the thing though is that I did not realize that 9/11 was following me, trauma of it was following me all these years until I started doing the interviews. And then all of a sudden it's kind of like, oh, okay, that explains everything. But in the meantime, though, to come this far and then to see, I'm not sure what the criteria might be or, what laws need to be passed, but I think that should be, that's significant and that really should be considered as a part of being compensated for.
So
yes.
I can just quickly speak from the history. There was a very strong push by responders and survivors to get mental health impacts covered, compensable by the VCF, but that was a non-starter in the Congress. And yes, people are still to this day unhappy, as you said, because a lot of us know people whose lives have been destroyed in some ways or very much impacted by 9/11 mental health trauma. And I don't know that there would ever be a way to revisit it, but if there ever were, I guarantee you there would be responders and survivors who were willing to make the argument.
Yeah, right. Thank you so much, Kimberly. Really appreciate
Yeah.
that.
Thank you.
Thank you. Okay, we have one more question. Can you guys hang on for another 5 minutes or so? Yeah, okay. Webster?
Yep.
Webster, you want to unmute yourself, please? Webster Leung, you want to unmute yourself, please? We can hear your
Yes,
question.
hi. I
Hi.
just want to make a comment. I was in the ground zero area. I was approached by one of the 9/11 insurance firms that covered the 9/11 issues, and basically I had to actually it was two colleagues that had health issues, and I basically filled out affidavits to say that we worked together, we were in the same office during that same period of time, and I believe that helped them get their application or submission to for claim. I guess it was at that point, and I believe it went through. So I just want to let people know if they have any issues, they might have to go through the route through one of the lawyer insurance firms.
Thank you
Push
so
the
much.
papers through.
That's very helpful to know. And it actually made me think of another question for Nicole, actually, which is so in Webster Leung's case, he was obviously in the same place his coworkers were, but he is not ill. Is that true? You're not ill and requesting assistance from the fund, but should he be registering anyway, even though he doesn't have a health problem? That and I'm not sure. You may have mentioned it before and I missed it, but I just wanted to be clear about like what to tell people to do.
Yes.
Yeah.
If they answer the question, were you there? Were they in New York City? Were they at Shanksville or at the Pentagon? Then they should register, even if they're not sick, because there are registration deadlines that are tied to like when you knew or should have known that your condition was related to 9/11. And so everyone should register. If you were in New York between 9/11/01 and May 30th, 02, register. We only need your name, address, contact information, telephone number, your social security number, very basic information. It doesn't obligate you to file a claim. If you never get sick, God forbid, you just registered and you won't have to worry about that deadline. And Webster, I encourage you, if you've already done affidavits or present statements for your colleagues, you should go back to those same colleagues and ask them to complete a statement for you, just in case in the future you need that for your own claim. We encourage everybody that can hear my voice. If you are not registered, register. I know a large number of you are, I think like 78% 28% of you.
Yeah, 28%, I think.
Are registered. The rest of you, please go register today. VCF.gov. Go register, please.
Thank you, Nicole. Really appreciate that.
Okay,
Okay, so I think
It looks like Colleen is waving her hand.
Oh, I don't have her on me. Sorry, Colleen.
It's okay. Excellent presentation. So thank you very much, Rob, for presenting this to us and for all the presenters. There's a lady that was on my staff at the time, and she came down with stomach cancer, and we've been in touch. And she said she submitted, no, I don't know the details, but she's just like gave up. So I'm going to call her as soon as we get off this, presentation, and just give her these phone numbers, because she definitely came down with stomach cancer and we were in the midst of it. So, and I myself have never registered, and maybe I need to do that. So thank you very much for the presentation.
Susan, can I just add one last point? I mean, I have been contacted, and other advocates as well, with people who have rejection letters from the health program that do not make sense. Okay. So There are people who have been told that they're responders when they're survivors and vice versa. And there are people who have gotten form letters that are asking them questions that are not appropriate for what they presented by way of their presence documentation. So if you get a letter from the World Trade Center Health Program and it doesn't make sense to you, then you can get in touch with us. You can call the World Trade Center Health Program, that 888 number. They do make mistakes. It's complicated. The whole process of putting together the information that's being provided to you on the application, and the enrollment processors don't always get it right. So you can get a letter like that. Again, I think quoting something that Nicole said, don't consider that the door closing in your face. Press on. Go back to them.
Okay, thank you. That's a good way to end it, I would say. Press on, continue. So since I see no other hands and it's 2:00, I would say we're going to wrap it up. But thank you so much to Kimberly, Nicole, and Stathi for such an incredibly helpful and important piece of information. Did you have something else, Kimberly? Oh, okay. Very good.
Thank you.
I just want to say thank you again, and everybody has your numbers, and hopefully as people have questions, they will be in touch with you. Okay?
Thank you.
Thanks again.
Thank you so much.
All righty. Bye-bye.
Bye.
So,
Bye. Okay. Do you need to
no,
say
I
something?
just was going to say before you let
Thank-
everyone else go.
Yeah, no. Okay. Okay, so thank you for coming up with that, Rob. That was wonderful. Okay, next we have the Comro report, which is going to be given by Mark Lewis this time. Mark?
At Comro, we had Stephanie Luce, who's a professor, and she was talking about a living wage. They want various unions to strike with the auto workers union in 2028 to try and get better health care, better hours, and lower retirement age. There's a May Day, is a National Day of Action, and working on organizing workers. They're working on organizing workers in the South and Southeast and Southwest to join them. So that was one major thing. In terms of our health benefits, Rob, I don't know if you know anything about this. They're now talking about possible tiering of use of hospitals with like HHC would not be charged, but Montefiore would be a second tier and being charged higher, and specialized hospitals would be even more expensive. Have you heard anything about this, Rob?
I think Susan was going to do an update on health issues after you're finished.
But
Okay.
I don't know anything about that. I think that's for employees.
Yes, I'll come. Do you want me to say something about that now, or do you want me to come back
Oh,
to
we
it
can
after?
wait till the health report.
Sure.
Thank you.
Okay, that basically covers it. Other than we're waiting for the Court of Appeals to respond to Marianne's lawsuit. The city has appealed all the way up to the Court of Appeals, and we're waiting for a ruling from them.
Okay, thanks, Mark. Appreciate it. Okay, so then we'll just go right into the health insurance report. I was going to ask John Manning, did you have anything to add to what Mark was just talking about the Benkowski? That's the one tomorrow, right? Where they're going to, the Court of Appeals is going to hear the case?
Hi. We'll know a lot more at the end of the week and the end of the month. Tomorrow on the 15th, up in Albany, is the ruling on the Bentowski case. And the Mary Ann's buses to go up there with supporters, they're all filled up now. And tomorrow afternoon, there should be news how the court has ruled on this thing. Knock on wood, this is the last, a last appeal for the city to fight this thing, but we'll see what happens. At the end of the month, the United Federation of Teachers, a dissident faction, ABC, is challenging the old guard at Michael Mulgrew and the Unity faction. And for a bunch of insurgents, they're putting up a darn good fight. I would not bet my paycheck, my NYSERS pension check on either side winning. But if ABC Slate, if they overthrow Michael Mulgrew and the old guard at the UFT, the balance of power on this thing changes dramatically. The big boys at the Municipal Labor Committee have been fighting this thing and siding with Aetna, Medicare Advantage, and City Hall. If the UFT election goes with ABC, it's going to change the political equation on this whole issue right now. The game certainly isn't over yet. So tomorrow afternoon, check out Facebook. Mary Ann's and the retirees organization. There'll be news on the Albany ruling on this thing. Before I landed the job in 1999 as a staff analyst level 1, I was with MetLife for 8 years at 1 Madison Avenue and 1 Penn Plaza. Those guys from Aetna, I was in the trenches with them. They'll stop at nothing. They're amoral and immoral. Money is God. And most importantly, they don't like losing. Why is this issue going on and on and on? The people who have been peddling Medicare Advantage, are they ever going to give it up? This is a nationwide struggle. They're trying to make Medicare Advantage the default option with this Agenda 2025 thing in Washington, and these guys don't like losing. Okay, these people at Aetna that are pushing this thing hard, and that's the situation. I encourage everybody to get involved in the retirees association. Mary Ann is extremely popular. She's a retired EMT. And she's been speaking truth to power and fighting lobbyists, corrupt politicians. I mean, it's been amazing what she's been able to pull off. It really is. And that's the situation there. And that's that.
Okay. Thank you so much, John. I really appreciate the update. We all do.
You're welcome.
Okay. And so let me also mention, while we're talking about candidates, and I'll get to you in a second, Rob. While we're talking about candidates, my understanding is, and John, you can correct me, or Rob, if you know, that there is now 5 candidates who've come out saying, mayoral candidates who've come out saying that they support the retiree fight against Medicare Advantage. So that's Walden, Cuomo, Brad Lander, Scott Stringer, and Jessica Ramos.
It's news to me that Cuomo was bored. Andrew Cuomo was on board on this thing. Mary
Yeah.
Ann, on Friday nights, she endorses and lets politicians running for the city council and running for mayor present themselves and do some fundraising, blah, blah, blah. Independent candidate Jim Walden is retiree's main choice. His law firm has been fighting this lawsuit, incidentally, for years. So he's very familiar, and he was the first one to say unconditionally, we're going to keep traditional Medicare and the GHI emblem system. And forgive the tangent, but that they're coming for the actives is not idle chatter. They want to stick the actives with Aetna or United Healthcare or something, and which is not going to be a good policy.
Right, right.
And um, so that's did that answer your question?
Yes, that's wonderful. Thank you so much, Don. Appreciate it. Rob, can I ask you to speak about the issue that Mark raised?
You can, but first I'm going to just clarify something that John said. What's happening tomorrow in Albany is oral arguments in front of the Court of Appeals. So there won't be, as far as I know, a decision tomorrow. You will be able to see is the actual, and I believe when the last Court of Appeals hearing was held on one of the other cases, it was live streamed. So there's probably a way to get access to that. I'm assuming that Marianne's group will announce that. And what we did last time was after it was archived, and we put a link on our website to the actual oral arguments that were done. So I don't know that there'll be a definitive answer tomorrow, but certainly you'll know the way the court, the panel of Court of Appeals justices will be thinking about the case and what questions they asked of the folks on both sides. I just want to sort of clarify that. Something else that was mentioned, which I want to clarify slightly, which is the UFT internal election. There's actually three slates. There's two oppositional slates and the traditional Mulgrew slate. So we'll all see how that all turns out. Just want to mention that. There was another question, which was the issue of that Mark had raised, which was really about tiering of hospitals. It's come up before. The Municipal Labor Committee has been dealing with the explosion of healthcare costs for a good decade, and how they've chosen to address this has been, on the one hand, to raise co-payments and co-insurance. On the other hand, to try to do this situation with Medicare Advantage. The idea of tiering of hospital systems is another idea that has been floated. Where that probably is coming up from in the person who is speaking at Conroe was that there's a negotiated acquisition for a replacement plan to the GHI CBP coverage, which is obviously for everyone who's active, who wanted a preferred provider organization in city service, or who is a pre-Medicare retiree. That is and they choose to go into GHI. That is the coverage that they get. That's often posed an interesting problem for pre-Medicare retirees who move outside of the New York City area. It's reasonably decent coverage in the metro area. Sometimes it covers in some of the other areas, but it's a weakness. It's not a national network. So the city has been for the last 2 or so years been putting out a request for bids on a replacement plan. Their argument was, or their framework was, that it should save 10% and yet provide just as good coverage as GHI CPP. Now, I'm not speaking for the union right now, but as a person of cynicism, I've got bridges for you. Anyway, it's just unlikely, but you never know. So what's happening now is there were two bidders. One was Aetna again, and one was Emblem in partnership with United Healthcare. Why United Healthcare? Because United Healthcare has national networks. So essentially, this would improve the coverage area. Aetna is a national network. we've seen the ups and I'm not speaking to whether this is, a good thing. I'm just saying that's why they're doing this approach. They have not selected one. It's unclear exactly when that will occur. They are trying to implement this by January 1st of 2026. And so we will see what that looks like. I would certainly suggest that it is not something that is very high on the radar screen of most active employees. And I think that's unfortunate.
Yeah. Okay, thanks a lot, Rob. I just had one other point on health insurance, and that is that, and other people can chime in if you know more about this, but I was reading this article about how the Municipal Labor Committee is suing the city of New York to stop them from going to arbitration to try to recover the $600 million the city says that the unions owe from promised healthcare savings. And the city is saying that it's the union's fault for promising this and then not getting it implemented. The unions are saying, well, we were on board with implementing it, but the city didn't do a good job of trying to do it, so we don't owe you any money. So that's what I know about that at this point. Does anybody else, do you know any more about that, Rob?
That's
No.
accurate. That's a good
Oh,
summary.
yeah. This thing never ends, right?
Well, excuse me, I don't under this bit that to square this circle, the unions, we need to pull out a magic wand and save the city 600 million a year recurring.
Yeah.
The city wastes $600 million a year on all kinds of silly nonsense. All this got started, if I can take everyone down memory lane, the Bloomberg horror show, 6 years without raises. He tried to get us to sign off on multiple years of zero, and everything was just cut, 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 cut. And the raises that didn't quite keep up with inflation at the beginning of de Blasio, gutting the insurance stabilization fund. This whole thing was a lot of baloney. The unions should have been united fighting this thing. And what the ABC slate at the UFT is saying is that we should have raises that keep up with inflation, and we should not have to keep shaving our health care and our pensions, tier 4 at tier 6, blah blah, more co-pays, more this is some sort of a bottomless pot we have here. Emblem GHI, what actives and retirees have, and being hooked in with Maimonides or NYU Langone or Columbia Presbyterian, one of the really major networks in town. I've got news for you. You got good health insurance. You really do, all things considered. And why do there's no reason at all to destroy this. This is a straw man that we need to figure out a way to save 600 million a year. Now, we're a union of analysts and financial people and budget people. If the city needs 600 million a year in recurring savings, we've made a lot of there's all kinds of nonsense going on with the city's budget, patronized jobs and that sort of thing. And that's the situation. That's how all this got started. The Bloomberg to de Blasio, let's raid the stabilization fund. Bloomberg's people wanted, instead of 10 years to be vested for your benefits, they wanted to make it 15 years. Internal documents show that. And it's all just a lot of baloney. The MLC, the unions, instead of arguing with each other, we should all be united in saying we want our benefits, we want our pension when we agree to become cops and school teachers and budget analysts. That's what we were promised. And as far as raises that simply keep up with inflation, if not a little bit more, believe me, if you we shouldn't have to cut our health care, cut our pensions, to pay for these things. We should all be standing up and fighting for these things together. And the big boys at the MLC, Garrido and Mulgrew, Bob, these guys have a case of the arrogance of power like I've never seen. I've got 2 university degrees in political science. I've studied big shots who had power and parties and movements. These guys are making 400,000 a year, and they've been there for a long time, and they've got networks of suck ups. And maybe we just need some internal change within the MLC here. You know, they should be fighting for us, not fighting for Aetna's lobbyists and this sort of thing.
Right.
Bob,
Well,
I really do. You and Adam and Bob Cronin and the whole gang. I love you. All of you. I really do.
well, thank you for your thoughts on this issue and all the helpful information, John. Okay, so anybody else have anything to add before we move along?
Yes, I do. DC 37 is saying that if anyone's council people support the bill to protect our Medicare program, that they're disendorsing them and they're voting and they're telling people to vote against them. So if you're voting in New York City, keep that in mind and keep an eye out for council people who are supporting us.
Okay, great. Thank you so much, Mark. Okay, anybody else before we move on? Okay. Actually, we're kind of coming to the end here. I just wanted to announce our next meeting. On June the 11th, we're going to have, this is a topic we didn't really put out earlier because we weren't sure what was happening in June. There was originally a plan to have a luncheon. But when we tried to have an in-person meeting in April, there just wasn't enough interest. So we've decided not to do the June luncheon this year. And instead, we're going to have our meeting as usual. And this time, we're going to have the Alzheimer's Association come back. They have a whole program on healthy living for the brain and the body. So, you know, we've usually we didn't have her this year because we lost touch with her, but the woman who was the nutritionist who gave us lots of really good information. But this is it's that plus also, you know, brain health, which I think will be really interesting, especially since we had the talk about Alzheimer's and we understand a little bit more about dementia and Alzheimer's. Okay, and then we'll be off for the summer, July and August. And I would ask people once again, I gave my pitch earlier, but in July and August, when we send you out requests for your ideas about topics, please really, you know, don't just cast it aside. Just email us or respond however we ask you to respond, because it really helps us to know what you guys want. That's what we try and do, provide what you want. So, or if you know of a person or an organization you think we should reach out to, you have a contact, you know, anything like that would be great and helpful. Okay, anything else before we wrap up? Okay. Rob, you have anything else to add?